Zika is a relatively newly discovered infection associated with the family of so-called flaviviruses. It's a single RNA virus, and it's being transmitted mostly by mosquito bites, but also through sexual intercourse, fluid exchanges, blood transfusions, and there are possible other ways to transmit Zika. There are two types of mosquitoes now that are known to carry Zika virus. One is called a tiger mosquito, and another one is Aedes aegypti mosquitoes. They are known to bite during daytime because most mosquitoes are usually after dawn, and they're pretty aggressive biters. To the best of our knowledge, first time Zika virus was described in a Zika forest, that's why it's called Zika, in Uganda, and it was in 1947. It's come from rhesus monkeys. It seems that it doesn't appear to cause congenital anomalies in monkeys, but once transmitted to humans, it's clearly associated with severe birth defects. But specialists in infectious diseases were aware of Zika presence for many, many years before. But it really never became a major health issue like now. Zika is clinically mild infection because it causes mild symptoms of rash, fever, conjunctivitis, which means you sort of get red eyes that are itchy. But once Zika virus gets into the bloodstream of the pregnant lady, it can cause severe birth defects for the baby. Well, the main issue with Zika virus and some other viruses, by the way, as far as how it affects brain development, is microcephaly. Microcephaly, in a simple term, is a small head. The baby is born and the head is disproportionately small. Unfortunately, the microcephaly in most cases is also associated with severe neurological disorders, such as seizures, learning disability. Some of them require intensive continuous care, feeding, etc. But not all cases of microcephaly are such. And microcephaly usually develops if a woman acquires Zika virus in earlier stages of pregnancy. But even at the latest stages of pregnancy, although less common, Zika can cause fetal demise, and Zika can be associated with dilated brain ventricles and calcifications. So it's not only microcephaly that it does in the fetus. Zika is being transmitted mostly by mosquito bites, but once Zika virus gets into the bloodstream, it gets into pretty much every body fluid, including semen, saliva, breast milk, etc. So clearly, sexually transmission of Zika virus have been clearly documented, mostly male to female transmission. And it's known that Zika can stay in the sperm for around 6 months. Well, regarding transmission of Zika viruses from infected mother to the baby, there have been many documented cases. Usually Zika, like other viruses, can cross the placenta, get to the fetus, and in some cases infect or damage fetal neural cells, especially in the brain. Fortunately, there are tests now being developed that could test urine, blood, amniotic fluid, and if necessary, other body fluids that could be tested for Zika. But it's unreasonable and currently not recommended to test everybody who came from the area affected by Zika. But on the other hand, somebody who develops symptoms of Zika infection, such as fever, joint rash, conjunctivitis, those are the candidates for testing. Patients commonly ask a question if they get infected by Zika virus, when the Zika virus can affect the baby and especially baby's brain. We don't have a very clear answer to that question, but we know that Zika virus during the stage of viremia, it's the stage when the mother develops symptoms, or shortly after that, can cross the placenta. And within a relatively short period of time after crossing the placenta, Zika virus have been discovered already infecting brain cells and affecting the brain development. But unfortunately, Zika is not safe even for the remainder of the pregnancy. It causes other ill effects on the baby. Currently, management of pregnancy with suspected or confirmed Zika virus should be very individual, depending on the circumstances. For example, if patient is confirmed that she is infected with Zika, in certain cases offer amniocentesis, because amniocentesis is removal of the amniotic fluid and analysis of the fluid for the presence of Zika virus. The next step is with serial ultrasounds. The problem is that, in general, microcephaly sometimes cannot be diagnosed until 22, 24, 26 weeks of pregnancy, because we see the baby is developing first perfectly normal, and that at later stages of pregnancy, we see that the size of the baby's head is lagging. So it takes serial ultrasounds, sometimes an MRI of the brain, to make a clear diagnosis of microcephaly, ventriculomegaly, or other problems associated with Zika virus. Unfortunately, currently there is no therapy for Zika in the fetus. Clearly, women, if it's prior to legal age to terminate the pregnancy, has an option to terminate such pregnancy. Otherwise, we just follow up and trying to make sure that we provide the best care both for the fetus and the newborn. The current recommendation regarding protections oneself from Zika virus is, first of all, avoid unnecessary traveling to high-risk areas, especially during mosquito season, which is very important. The CDC usually issues guidelines. They identify online certain areas where Zika have been registered, so clearly you really need to follow those guidelines to make a decision when to go and where to go. If you do have to go, then obviously all the common sense precautions are very important. Number one is particular clothes that will prevent mosquitoes from attacking you. You should use mosquito repellents not only on the skin but also on the clothing. That's very important. Current CDC guidelines regarding prevention of transmission of Zika infection by sexual route is either use condoms for at least 6 months if the male partner was infected with Zika or has confirmed Zika infection, or abstain from sexual activity. And if someone develops the symptoms that may indicate infection with Zika, then clearly further testing is required. Regarding treatment, most symptoms of Zika infection are very mild and require just symptomatic treatment. Currently, there's no vaccination in place, but clearly there's a lot of groups that are trying to develop Zika vaccine, and hopefully within relatively short period of time it will appear. So you really need to exercise reasonable caution and take all the necessary measures to prevent oneself from being exposed to the virus.